Thanks, JC, and welcome everyone. Thank you all for joining our webinar today on managing workforce well-being. And in the next 45 minutes, we'll engage in a conversation with our expert panel about trends in workforce well-being and specifically in ways to optimize an employee assistance program. And as JC mentioned, you will have an opportunity to pose questions to our panelists using that question or the chat feature, which is over on the right-hand panel of your screen. And we'll try to address as many of your questions as possible during our discussion, or if we don't get to them during the discussion, we should have some time at the end. So here's what we're going to cover today. First, we'll look at some trends regarding workforce well-being, and we'll discuss some of those trends with our panel. We'll talk about the role of employee assistance programs in addressing these trends and how EAPs can be more effectively utilized by both employers as well as their employees. We'll cover best practices in positioning, communicating, as well as promoting EAPs to drive greater utilization. And we'll talk in some detail about Leigh University's EAP partnership with integrated behavioral health and some specific and very recent case examples. And as JC kind of mentioned, this webinar is actually an encore presentation of a panel discussion that we had at the annual forum in San Francisco back in March. So we're happy to have our panelists come back together again today. So I want to briefly introduce and welcome them. Later they can tell us a little bit more about their specific roles as they relate to today's discussion. First we have Linda Lefevre, Human Resource Associate at Leigh University in lovely Bethlehem, Pennsylvania. From the Integrated Behavioral Health team, we have Andrea Mander, who is Director of Innovation, Strategy, and Business Relationships, and Dr. Ryan Morgan, Senior Clinical Care Manager. Both Andrea and Ryan are based in the IBH headquarters in Southern California. And then Judy Busick is Life and Disability Product Director at Guardian Life in our Bethlehem, Pennsylvania office. So welcome to all of our panelists. So let's get started with a brief look at workforce well-being in America today. And to do that, we're going to turn to Guardian's 2016 Workforce Well-Being Index, which was designed to measure how working Americans are feeling about their personal finances, their physical health, and their emotional wellness. Now, perhaps not surprisingly, the self-reported wellness scores in each of these three areas were rated really fair at best, an average score of a 3.26 on a 5-point scale, or a 65% grade, which is really barely a passing grade. The emotional component of the well-being index, that's a particular concern because, as we know, stress can often cause or exacerbate other physical health conditions, and we find that 8 in 10 working Americans recognize that they need to reduce their stress, but nearly half say their current stress levels are either fair or poor, and they're really doing very little to change that. And the main driver of their stress and of overall well-being is their financial situation. Money is the top stressor for more than 4 in 10 working Americans, followed by job or work-related concerns. And then health problems, either their own health or the health of a family member, which for many baby boomers requires some form of caregiving. And of course, we know that adds even further stress. As I'm sure you know, the United States is in the midst of a drug overdose epidemic. More people died from drug overdose in 2015 than in any other year on record. Over 50,000 overdose deaths, a more than 100% increase since 2002. And more than 60% of those deaths from drug overdose involve an opioid, with nearly 100 Americans dying each day from an opioid overdose, mostly from prescription opioids and heroin. And many Americans suffer from mental health or substance abuse disorders, and in some cases both, and they need help. In addition to the stats that you see on the screen, among working Americans ages 18 to 44, depression is now the leading cause of disability claims and often tied to substance abuse. And today, mental health and substance abuse account for more than 20% of all new disability claims in the U.S., the fastest growing disability claim types, second only to musculoskeletal claims. Unfortunately, many adults suffering from mental illness don't receive treatment, which prevents them from getting better and improving their ability to function effectively at work. In fact, in the last 18 years, with the increase in the incidence of heart disease and cancer, well, those have actually been gradually improving. But the U.S. suicide rate during that same period has continued to rise, is actually up 25% since 1999. More than 60% of those diagnosed with a mental health disorder have not received treatment in the past year, and yet treatment has been proven to improve presenteeism as well as absenteeism by anywhere from 40 to 60%. So why don't more individuals with mental health disorders seek and receive treatment? Well, for our first audience polling question, and we'll have 4 of these, we'd like to know what you think is the main reason adults aren't getting treatment for mental illness. Just select one answer, and I will put that on the screen now. And you can select one of the answers, and we'll share the results from the audience poll and then compare those to our audience answers with some industry research on the subject. So feel free to make your selections. We'll give you a few seconds to do that. Okay, we have just about 80% voting. So thank you for your votes. Let's close that out, and we'll see. So number 1 response from our audience was not knowing where to go for help, followed by, it looks like, affordability, confidentiality concerns, and concerns about impact on the job. Let's see what our research shows. Actually, from some recent industry research, affordability was the number 1 response, and by quite a bit, almost twice as likely to say affordability than to say they didn't really know where to go for services, or that they had tried to handle their situation without receiving treatment. And then even further back, not having time might have a negative effect on their job. And then last in this list of 6 is concerns about confidentiality. So I'd like to turn to our panel just for a second, maybe first start with Andrea and Ryan. What are your thoughts about the audience response as well as the data from the industry research? Is this consistent with your experience?
Sure. This is Andrea, and as Jean mentioned, I'm Director of Innovation, Strategies, and Business Relationships here at IBH. And a lot of what I do is actually educating employers how to promote the EAP, as well as improving our programs and making them better and easier to access. My thoughts, actually, before looking at the statistics, was that it would be not knowing where to go for services. I think a lot of people don't know how to get started when they do need help, and that can be a problem for many people. Affordability is absolutely a concern as well. Ryan, what do you think?
Yeah, I agree, and we see this a lot too. Even though if we're getting calls, obviously people know where to find us to some degree, but the questions can really range too on what services are even available, even after an employer's been given an orientation, or even after we may have a presence and be there for a health fair and hand out pamphlets or whatever. People will still call and not really know where to go, what to do, or even what's available. And I think I'm going to talk more about that a little bit later. But definitely those two, the top 2, both of this research here and what the audience said, I mean, those same top 2 points. I think we see that a lot.
Linda, how about at Lehigh University, anything to add in terms of what you've seen?
Yes. First of all, greetings from beautiful yet soggy Bethlehem this morning. My connection with IBH, the EAP, is through my employee relations role. And I would say that for Lehigh staff and faculty, the 3 leaders are affordability, time, and confidentiality. We believe, and I think our numbers support, that most of our employees, mostly staff, know where to go, know who to contact. and we'll talk about those things a little later on.
All right. Thanks, Linda. So we're going to go to our second audience poll question. One potential source of help for those suffering from mental health disorders or anxiety, stress, substance abuse is an employee assistance program. So for our second question, let's find out how many of your companies currently offer an EAP to your employees. And if you aren't sure, you can see there is a not sure option as well. So I'm going to bring up this poll. And please make your selection. We'll give you a few seconds to do that. And then we will show you how this compares to some recent Guardian research. Okay, we're already up well over 80. We'll close that out. So about 80% of you said yes. Only about 20% said that you did not have an employee assistance program. And let's take a look at what we found from our latest Guardian research. On average, we find that, interestingly, about the opposite proportion, 20% of employers in the marketplace say they do have an employee assistance program available to their workforce. And that's really because most small employers, those with fewer than 25 employees, are not using an EAP, but as many as, actually, the same percent that we saw in our audience poll, 78% of large companies do, in fact, offer an EAP. So most employers have an EAP that is attached to or embedded within their group disability or group life insurance plan, and consequently, many of those employers know very little about the services that are included in the EAP, and they tend not to promote them very much or not to communicate them very effectively to their workforce. Let's go to our panel once again. What are your thoughts here, Judy?
Yeah, Gene, I think it's interesting, and it highlights the importance, I guess, or the recognition that those smaller and mid-sized employers need to have around having an EAP program in place. An EAP program, it can be a very good return on investment for employers. The cost of an EAP program is really relatively very inexpensive compared to an overall employee's benefit package. It can represent anywhere from less than 1% of an average employer's annual cost that they spend on an employee's health insurance package. Yet the return on investment for an EAP program, when used properly, can have a really good return on investment, reducing absenteeism, increasing presenteeism, and promoting overall wellness at the workplace. EAPs are important in particular on the smaller employers also because usually the smaller employers have less access to human resources and wellness resources at the workplace. So an EAP program can be an extension for that. So I'd like to see those numbers increase for the small and the mid-sized employers as a way to help them with their overall absenteeism and presenteeism programs.
Yes. So let's go to our third audience poll question. And for those of you whose companies do have an EAP and you responded yes on the previous question, we want to ask now approximately what % of your employees are in fact using the EAP. So kind of to Judy's point, having the EAP is kind of the first step, but actually communicating it properly and being able to promote it so that you get participation is really what it's all about. And so your best estimate here in terms of participation within your own companies, that would be great. Just for the purpose of this poll, really just your best estimate is fine. And I will bring up the poll here. And please select the range that comes closest for you. So just select one answer. We'll share the results and then compare the stats from our audience poll with our latest workplace benefits study. All right. over 70%, so let's close that out. So looks like about 85% of you said that the participation in your EAP is less than 10%, and that is exactly what we're finding in our latest research. On average, we find that fewer than 1 in 10 employees who do have access to an EAP have ever used it, and that's too bad because, as we've seen, many working Americans who have a mental health or substance abuse problem are not getting the help that they need because either they believe they can't afford the cost of treatment or, as we said, they don't know where to go for treatment. So EAPs remain a relatively untapped means of support for workforce depression and for stress management. So for our final polling question, we'd like to know what you think is the main reason employees do utilize their company's EAP. Again, select one answer, and we will then share those results of the audience poll and compare those to our latest research from the Guardian Workplace Benefits Study. Primary reason employees utilize your EAP. All right, let's close that out. So it looks like a mix. Financial legal guidance, along with health and wellness, relationship counseling, and stress reduction. So nice to see that there's some diversity and that, at least in your company's employees are using more of a variety of the services available. Let's see what we found in our latest Guardian study, though. Most workers are unaware that an EAP is available through their employer, or they believe that the EAP is really only for those with a substance abuse problem or mental health issues. So, in fact, we found that a high percentage, 84%, were using the EAP more for counseling and stress reduction. So, little difference in terms of our study, much more of a concentration. So that may suggest that there's better communication promotion activities among your companies in terms of the full range of services available within your EAPs. Which kind of brings us to this next slide. Judy, let's talk a little bit about the wide range of services that are, in fact, included in many EAPs that can benefit, as you mentioned before, not only the employee, but also the employer.
Yeah, I think a lot of folks recognize that an EAP program does have access to face-to-face counseling for mental health-related issues, and your typical issues that you would have there for counseling would be drug or alcohol-related counseling, personal issues such as divorce or relationship issues. But EAP programs also include other benefits that are not as well recognized, such as work-life balance benefits. These could include dependent care consultation. EAPs could provide access to referrals for child care or referrals to agencies assisting with elder care for parents. And these are important issues with a lot of working adults today. About 47% of working adults are in their 40s and 50s and are in that sandwich generation. Where they have concerns with elder care and or child care at the same time. Another thing that's kind of not recognized as part of an EAP program is financial tools. A lot of EAP programs will have access to financial guidance or financial counselor or have financial tools included in their EAP website. Financial is listed as one of the top reasons employees have stress today, financial concerns. So that's kind of an under-recognized tool that's in an EAP program, as well as legal services. A lot of EAP programs will have access to legal services, including guidance on developing your wills, guidance on necessary legal forms that you would need for child care and things like that. Many programs also have health and wellness promotion tools that are built into their EAP program or have access to resources for that. For employers, there's a lot of support actually at the employer level, and this goes back to, in particular, for the smaller employers that may not have as big of a human resource or as much as a human resource department as a larger company would. So managers and supervisors can get support on handling mental health issues or stress or addiction in the workplace, how to recognize these issues and actions they should take with their employees. They can also get guidance on communicating in difficult job situations such as a merger or a layoff or a critical incidents that happens at the workplace such as a death on the job or workplace violence. Also, we talked a little bit about absence management, and the EAP program can help employers recognize problems that they're having from an absence management standpoint and give some solutions and recommendations for improving absence management at the workplace.
Thanks, Judy. So again, the main reasons we find that most workers don't utilize the EAP that is available through their employer is because either they're not aware or they have incorrect perceptions or even no perceptions at all about what the EAP is all about and the types of services that are included. So, Judy, what are some of the ways to combat this?
Well, I think the main thing is to raise awareness. Some EAP programs are in place at an employer, and there's very little awareness at the employee level that this program exists, that it is free to employees, and the wide variety of resources that would be included in an EAP program. It's also important to really change the perception of the EAP program. Employees need to feel that it is a confidential program. There's some concern sometimes that employees feel there's a stigma around reaching out for help, or they feel it'll be viewed as a weakness and it could possibly impact how they're viewed at the workplace. They also, again, they really need to be confident that it is a confidential program. There's sometimes a misperception that they think they need to get their supervisor involved and things like that. So anything an employer can do to promote and overcome those misconceptions about an EAP program helps. I think it's also important to introduce employees to some of the tools that are available in the EAP program. An employee that is more likely to go and use the website for a financial question or college planning, after they get on the website and they see that there's a variety of tools available to them, they are more likely to use that EAP program for more critical situations. So employers really can help change some of these miscommunications through improved communications. And like I said, introducing the employees through some of those other softer EAP programs. So we are encouraging employers to have continued ongoing communications with their employees through newsletters, flyers, any type of internal communications that the employer uses to disseminate information to their employees. Also, if there's any opportunities to promote any of the educational seminars that many EAP programs have. So the EAP program that we offer to our customers offers a monthly EAP, a monthly seminar on just some relevant topics, some financial training tools, college planning tools, and those, again, are all very good topics to get employees kind of hooked in or introduced to the breadth of tools that are available through an EAP program. We find the most successful employers are those employers that really have a great deal of support at the manager level and the HR level, and are trained in the EAP program and really kind of encourage employees to use the program.
That's great. Thanks, Judy. And Linda, I know we're going to talk more about the communication strategy that you're using at LEHIGH in a little bit, but before we move on from this is, I think, a really important one. Andrea, from your perspective, because you have quite a broad view of the various communication options and strategies, which of these have you seen kind of be most effective?
Well, I think that Judy was right on about the changing the employee perception about some of the tools that are available, using those other communication pieces and the educational pieces that get them interested in finding support for things that might not be critical situations, but can overall provide some work-life balance.
Okay. So EAPs have demonstrated positive outcomes. I mentioned that earlier for those at least who have used them. And Judy, you want to talk a little bit about some of the outcomes that research has proven so far?
Yeah, it's estimated that there's over 400 million days lost per year due to depression. In addition to lost work days, someone who's suffering from depression is 70% less productive than someone who is not suffering from depression. So not only can an EAP program help with reducing absenteeism, and it can also help with reducing presenteeism, those employees who are at work but just not performing up to their level of productivity. There's, like we said earlier, there's definitely a really good opportunity to use your EAP to help the outcomes of both absenteeism and presenteeism.
Okay. And you touched on this earlier, the benefits not only to employees but also to employers, and probably many employers overlook that. Can you tell us a little bit more? I think these may not be as well understood.
Yeah, so we talked a little bit about, lowering the cost of stress. Again, when someone is at work and they are having a stressful situation or something, they're just not up to their normal standards of productivity. One of the items that we see as the top cause of stress is financial wellness. And again, that's something that the EAP programs have access to tools to help with financial guidance and some financial wellness. So again, an EAP program can be really an important tool for employers to, increase the productivity of their workforce, decrease absenteeism and sick leave, and improve overall efficiency at the workplace. Reduced risk of litigation is one we have listed here, and this is very important that, again, in particular for the smaller employers and the mid-sized employers that may not have access to an extensive HR department or extensive HR resources. An EAP program can really help the managers and supervisors recognize a problem at the workplace and walk them through the steps that should be taken with that employee. That maybe there's an employee on the job that is having an alcohol or drug abuse situation on the job, and it's important for employers and managers and supervisors to recognize what their responsibilities are. An EAP program can help walk supervisors through that, also get them set up with some mandatory referrals and things like that.
Okay. Our research shows that benefits integration and taking a more holistic approach to managing workforce health, like by connecting the dots to leverage various health benefits and leave management processes, this is becoming increasingly important to many employers in the market. As the name suggests, integration is a real focus for the team at IBH, Integrated Behavioral Health. Ryan or Andrew, can you tell us a little bit more about your recommended model?
Sure. This is Andrea. So IBH has several models of EAP that we promote. With the Guardian, we have a value-add EAP, so it's kind of individual and sits kind of apart from the rest of the benefits. However, we have found that working with Guardian and working with the employers in this population, when we combine the EAP with disability or with FMLA, there's going to be better outcomes overall. If somebody's going out on disability for any type of medical concern, whether or not there is a behavioral component, there are tools available within the EAP that can help that person. Sometimes it could be helping find transportation, helping find additional child care or in-home care for when they're out on that leave. Same with the FMLA. When somebody's coming back to work, we can help find those extra resources that's going to make it easier for them to come back to work. Now, IBH also, we do have a full managed behavioral health carve-out program that we do for larger employers, and Leigh University is actually one of those employers where we do both their EAP and their behavioral health services. So that gives us a little bit more leverage with the EAP. Sometimes we'll have, so the EAP is really short-term assessment and problem resolution. However, a lot of people might not know if they need full-on treatment for depression or if they're just having a really bad month. With the EAP, they can get that triage. Okay, can we address this situation in the short time period of the EAP 3 visit sessions, or is this person going to need longer-term treatment or therapy? With the integrated accounts, we can have that capability to direct them straight into the longer-term treatment if needed.
Yeah, as a clinical care manager, too, having the ability to do that is really important and does, I believe, makes a big difference with how we can direct care, what we can recommend. We just have more resources available at our fingertips with what we can do with an employer who has an integrated account. So if somebody calls, we get a lot of calls on the EAP side for employees who really do need more than what an EAP can provide. And if the managed behavioral health benefit is integrated in, we can then talk to them about those resources and also continue to be involved and follow the case. Whereas if it's a person who just has the EAP product, we may not know what happens after we make our recommendations and our referrals.
Yeah, and we do make those recommendations and referrals outside of the EAP when it's clinically appropriate. We'll help them find the resources that are going to best meet their needs in their own medical plan if possible. And then the other one that we have here with the wellness program, IBH does have a wellness program, and we do have some accounts that have EAP and wellness. And so in that scope, we can identify people who might be dealing with wanting to quit smoking or COPD or diabetes or other health conditions, and we can really provide a holistic approach to their care beyond just the medical or the behavioral side of things.
Thank you both, Ryan and Andrea. I want to just mention, because we're getting a lot of questions about the availability of slides. So these will definitely be made available to you after today's session, along with the on-demand replay as well. So I think you've already touched on this, Andrea and Ryan, but the referrals to counseling service is a big part of what you do at IBH. You want to talk a little further about that?
Sure. So these are our actual top referral categories for our Guardian book of business. And with Guardian, we have a value-add EAP that's embedded with some plans. And the number one referral category is individual counseling, and that's for any stressor in life to get those interventions in place. I want to add that the legal problems, it's also combined with financial. Sometimes they're one and the same. And then down to the relationship, marital counseling, and family counseling. And then number 5 on that list is our manager and supervisor consultations. We do quite a few mandatory referrals, whether it's a behavioral issue that comes up in the workplace or if it's a failed drug screen, harassment in the workplace. Ryan deals quite a bit with those type of situations, and we do what is the best for that individual. We do require that employees sign a waiver, a release of information, so that we can communicate with the employer, and that's really the only time that communication happens. On these other categories, there is no communication back to the employer about why people are calling. We do,
or who is calling. Yeah.
We had a question, which might be a good time to ask it right now. It said, assuming it's about whether the information can be shared back and forth between the health coach and the counselor.
For the programs that we have integrated with wellness, yes. And typically, and this can happen both ways. Either somebody will be in a health coaching session and it becomes apparent that there's some outside stressors in their life that might be impacting their ability to address the health concern, the wellness coach will communicate to our EAP, Mary is having some extra stress in her life. She's in our health coaching program. We're going to transfer her over to you to get some additional resources. We don't obviously communicate the details of those conversations, but it is noted in the system if somebody is receiving care on both sides, because it will help them get through those problems better.
One last question I'll ask now. If an employer has the embedded type plan that you described, Andrea, where it's tied in or linked to, say, a group life or group disability plan, employees who are, for whatever reason, not a part of that plan, would they also have access to the EAP?
So how we do it is all benefit-eligible employees have access to the EAP. So pretty much any full-time employee, it tends to be tied with the employer-sponsored benefit. So the company might have disability, they might have life, they might have dental and vision, whatever the case may be. It's tied to whatever the employer sponsors. They don't need to elect all coverages.
Okay, great. Thank you. Moving on, this is just a partial list, I believe, correct, of the many different consultation topics that you address at IBH. Which of these are, yes, say, most prevalent?
Most prevalent. And I'll let Ryan talk about these since he works on most of these consultations on a daily basis.
Yeah, I mean, we certainly get a lot of consultation about a lot of these things, both from employees calling and also employers calling on behalf of employees. Do we see a lot of what seems to be on the rise that you mentioned earlier, the alcohol, drug use? Get a lot of that and getting a lot more substance abuse related concerns, especially from employers and employers who are doing drug testing. There definitely seems to be a rise in people testing positive at work, not only for the employers who test in safety sensitive positions, but also for the ones that test in non-safety sensitive positions. They just have, whether it be a random pool or a post-accident situation or reasonable suspicion. But that is definitely on the rise, and it needs to be highlighted there. It seems I'm talking to people multiple times a day about those related concerns. But yeah, it's a good list. All of these things are represented.
And the utilization rate that we saw earlier of less than 10% in the market and even among our audience, what are you seeing in terms of differences by the various model types?
Sure. With the embedded model, this is the program that can get forgotten or doesn't get the attention that it needs when it is sold sometimes, or there's employer HR turnover or leadership turnover, and people forget that they have it because they're not paying the bill for it, so it kind of gets forgotten. So with the embedded model, we really see 2 to 3% utilization, and that's overall. There are exceptions to that. A lot of times we'll have groups that really are looking for the EAP, and we can see up to 15% usage for the groups that truly are promoting it. This tends to be the larger employers. The mid-sized to large employers are really the ones that see the value of the EAP and get it in front of their employees more frequently. On the other side of this slide here, we have for our standalone and integrated accounts, we see much higher utilization, everything from 27 to 75% utilization, and I think we even had one group this year that might be higher than 75. I'm in the midst of doing our annual reporting, and it's very interesting to see, especially the groups that get their leadership engaged, take advantage of all of the training that's available, have us out for health fairs and CISD, and they're effectively promoting it beyond just our FaceTime with those employers. Great. And we did have one question, which I think we'll address later, and it's one of the 5 tips that we have that we'll leave folks with at the end of the webinar. But asking your EAP vendor for
data, statistics. There's a number of attendees to our webinar today who commented that they don't know what the participation rate is. They haven't seen data. Any advice on that, Andrea?
So here at IBH, for our Guardian book of business, we do semi-annual utilization reports. We actually have a portal on our website where those reports can be accessed with an access code. If anybody needs it, I can be reached. I believe my contact information is on here somewhere. And then for our standalone groups, we do quarterly and then annual review of our entire programs. The utilization reports for the embedded, it's very basic information. It's number of people who have called, the number of referrals that we have authorized, and then we do actually a call out on legal and financial referrals as well. We don't identify any information on types of services. For groups over 1,000 lives, we can do that, but under 1,000 lives, especially with the much smaller groups, it's too easy to identify who the people are, so we don't want to give that information out.
Got it. Okay. Thanks, Andrea. So, Linda, let's turn to Linda. And, Linda, I did get a couple of comments saying if you could, I don't know if there's a way of turning up your volume on your end, but before we kind of turn to you here, I wonder if there's a way for you to do that. But, you know, given the exceptional utilization that I believe you're seeing with your faculty and staff at Lehigh, we're really anxious to hear from you some of the ways that you're currently communicating and promoting the EAP at Lehigh University.
Okay, and I did push the volume on my phone up to max, so I hope it's helping.
That sounds better.
Good. Okay, great. At the time that I joined Lehigh 19 years ago, we had another EAP provider, and 14 years ago we partnered with IBH. And I believe one of the reasons that we went with IBH was due to the integrated account with a higher level of service. In all honesty, I did not know our utilization rates, and through the preparation for the conference in March and this presentation, learned that Lehigh University is indeed a super user, as I call it, and that's why we were asked to be a part of this. And what I can tell you from my professional and even personal experience with IBH is I honestly couldn't do my job if I didn't have IBH backing me up and the ability to call Dr. Morgan whenever something would crop up that I needed further assistance or needed to refer to EAP.
Yeah, and that's a good point too to bring up here too, is that relationship, number one, and then also just Linda knowing that she can pick up a phone and call, you know, me or one of my colleagues here, even if it's just to consult, you know, to do a management consult. Hey, I have an employee, or I have a situation, or this is going on. What do you guys think? And we can jump in, offer resources. You know, whether they end up making a mandatory referral, a management mandatory referral, or if it's just for some guidance and direction, you know, that's something that we definitely do utilize, and Linda's great about that.
And this slide here just shows some of the different ways, Linda, that Lehigh is promoting the EAP. If you want to comment on some of these, and then I'd certainly welcome the IBH team to comment as well.
Sure. I'm just going to, you can see the list in front of you. I'm just going to comment on two or three of those. We have an online newsletter. HR puts it out almost monthly, about 10 or 11 times a year. And at least once or twice a year, we either select an EAP topic for an article in the newsletter, or we do an article on the IBH services, the EAP services. And we are fortunate to have a communications person on our team. If there's anything I've learned from her is, you know, you need to communicate not once, not twice, but 3 times. So then when we do an article, and we do this with basically all articles in the online newsletter, we will also make reference to it in our Work Life Twitter and Work Life Facebook accounts for Lehigh faculty and staff. Previously, we used to have IBH come out and do an information session. What we found worked better for the presentations at Lehigh are to select a hot topic, an EAP hot topic, and Ryan would present on that, and then towards the end of the presentation, he would roll out all of the IBH services for LEHIGH. And then certainly it's important for LEHIGH, for me, to have the partnership with IBH and with Dr. Ryan Morgan. I think it's also important to have a face for your employees. Probably many of you on this call you may have individuals nationally, maybe even globally. We're fortunate that 98% of our staff at LEHIGH are right here in Bethlehem. So I have an opportunity. We have a benefits orientation where they hear about IBH, and then I also speak with them and spend an hour or two at the new employee orientation, and they hear about IBH again. And so those three that I mentioned are probably our most effective ways of promoting the EAP. And one other thing I will add to that is we know we've received feedback that our staff, they have a high level of trust in the employee relations team here at LEHIGH, so I think that goes a long way too. Great.
This next slide is obviously based on some data that was pulled together. We appreciate you sharing this in terms of utilization by type of service, and these are from 2015. Looks like the behavioral health referrals really represent, looks like more than half of the total utilization. And has that been increasing, or has it kind of leveled off since then?
I think that's about the same. Some areas where we are seeing increases, the web users for work life, and that's driving folks to the IBH website. We've had a more than 50% increase there. People meeting folks from IBH at our health and benefit fair, that's tripled. And our management consultations have more than doubled, which really isn't a surprise to me, nor should it be a surprise to Dr. Morgan.
Not a surprise to me, no.
Any comments on here from the IBH team?
I actually got Linda the updated numbers on some of these items yesterday. We're about to deliver their annual report. So I don't have all of the information to get gathered yet, but work life, so they're using the website a lot more. We're getting more people interested when we are actually on site for the health and benefit fairs. We didn't do as many on-site workshops this year, but the attendance was about what we would expect. So that was great, and I think overall our usage is just up this year, so that's good.
Yes.
Good. Linda, I know you have a couple of different case examples that you want to share with us.
Yeah, some that stand out, and certainly Ryan, jump in here at any point. A couple of years ago, we had an employee who had been diagnosed with early onset Alzheimer's. She was in her late 40s, and Ryan was able to coordinate some memory support meetings and assistance for that employee. So that's one that always was one of those things where I didn't know what to do, and certainly Ryan was able to step in and help not only me, but help that employee as well. We have utilized IBH in situations of employee death, sudden death, or suicide. And then the other time that most often IBH reaches out to us before we even contact them is if there's something in the national news. And we had been in the national news within the last 2 years when our rowing team was in a bus accident. Right.
Yeah, so even hearing, we found out about like that particular incident and knew right away, one of our officers knew and identified Leigh University, so we were able to reach out quickly, make sure that we remind them, hey, we're here, we're where, please give our number out to any family or friends or anyone who might have been impacted to call. Also, too, when we do that across the country, like after Hurricane Katrina hit, we have some big accounts in the Gulf. We were down there on site, and again, making sure people knew of resources available, getting involved and helping however we could. So as much as we can be proactive, we try to be, even if it's just reaching out to an account to say, hey, we heard there was a shooting near you. You may have some employees involved. Here are some handouts you can provide to your family or friends or your employees. So things like that, as much as we can help or be involved.
Anything very recently, Linda? Unfortunately, there's been some news of some tragic events just in the past week. Anything recently?
Nothing for us, but one of the other panelists, I think, Judy, it might have been you, said something about the incident with the person driving the vehicle through Manhattan that there was a reach out to.
Yeah, that was me. That was Andrea. So the incident that happened last week with the man who drove into a crowd in Times Square, right. We had one of our employer groups that has an office right there, and their employees were very clearly shaken up. We were actually able to coordinate to get a counselor on site to them the next day.
And we did have a case here in recent months where an employee called me and a vehicle had driven into her home, and she had to be evacuated from her home. And then there were some other extenuating situations there, I believe an autistic child. So she needed a lot of help on a lot of different fronts, and I referred her to IBH.
Yeah, and again, it's a good example of LEHIGH's integrated product of having the managed behavioral health benefit with us as well as the employee assistance, the EAP. So in a case like that, we can direct to, okay, you might need some legal consultation. We can direct you here. You might need some financial consultation about how things are going to play out because of this recent thing and waiting for insurance or whatever it might be. And then also just, is your son in services he needs, and what's going on with that? And then do you need any personal counseling? We're able to kind of hit on a more of a complete or a full picture and then manage those needs more completely. Great.
Well, in the last few minutes that we have, let's just kind of summarize. We have a couple of takeaways. I think we had 5, actually. And we'll ask our panelists to maybe help me in recapping these one at a time. Starting with Judy, the whole concept of kind of know your EAP, know the services included, and know your vendor contacts.
Yeah, I recommend, oftentimes, unfortunately, an EAP program, when it is sold or when it is included as part of an overall benefits package, it may not necessarily get the attention that is required because there's so many other products being installed at the same time. So I do encourage, the HR contact or the benefits person at the employer to really dig in, find out who your EAP provider is, and make some initial contacts with your EAP provider. And they'll be, more than happy to go through some of the benefits of the program and how the program works. And developing that relationship is a really good first step to encouraging the overall utilization. We also, say work with your carrier on promoting the EAP services. Oftentimes there's newsletters, there's monthly posters that can be posted at the website or sent internally onto your intranet to encourage the EAP utilization. And again, oftentimes we see when we encourage some of those softer EAP services, utilization will increase overall on the program. And then, like I said, making that connection with your HR staff or if you have a health and safety team or a benefits team at your company, use them as an extension of your EAP, or use them to connect with your EAP program. And ultimately, what you'll find is a very successful model is when HR or the health and safety team starts to rely on their EAP contacts as an extension of their team. So making that initial connection and then having that ongoing relationship and using the EAP resources as an extension of your EAP team really benefits the employers, the managers, and the supervisors at your team. Along
Great.
with that, you might want to develop an EAP champion in your organization. We've seen success stories with that.
And Linda, maybe you can comment on that as well. I'm sure you've identified some champions too.
At least.
You are the champion.
The best way to for us, again, because we have a population of about 1,800, I'm able to get my face out there with folks. And certainly the communication pieces we use, utilizing the web, that's helpful. And I'll just tell a very short story. I had a couple months ago an employee walk through the front door. I happened to be covering the front desk space over the lunch hour. We take turns doing that. And he said, oh, just the person I need to see. I need the number for our employee assistance program. And I just happened to have a sticky pad, and I wrote it down on a sticky pad off the top of my head. And he looked at me and he said, oh, that was scary. The fact that I knew it off the top of my head, which it isn't from my perspective, but they do know that I'm the person who, and my supervisor can certainly get them the help that they need, get them the information that they need, so they know who to contact.
Great.
Yeah,
and lastly, go ahead, Ryan.
But I was just going to say quickly, there are times like that where it may not even be a management referral where management is mandating something, but it may just be a recommendation, and Linda will call and give a heads up. Hey, just a heads up, I talked to this employee. They may be calling for these reasons. I don't need any feedback. I don't need to know anything. I have them ask for you so I can make a more direct connection. So that's another way that it might help an employee feel more comfortable reaching out. If there's a suggestion by someone they know and trust at their employer that says, hey, call and talk to this person directly. They're expecting your call, or they can be available for you. So that's something that Lehigh University does, and other companies do as well, that is definitely useful.
Hey, Ryan, why don't we stay with you and cover that last of the 5 key takeaways, integrating with behavioral health and wellness.
Yeah, I mean, like we talked about earlier, the integration, there are definitely advantages to that from my perspective, from doing clinical care management. If I have access to be able to deliver more services, then, we can just be more involved, more effective, follow cases more thoroughly, from start to finish through EAP, through longer-term treatment if needed. IBH here, we also more recently have developed a resilience coaching program, and so being able to work with people on even another level to do more resilience coaching and stress management work. It definitely see the benefits in integrating whenever possible.
Yeah. Well, we've captured these EAP tips in a one-page flyer, and we'll be sharing that with all of you for you to use within your companies. IBAI will be sending out a digital copy of that along with a link to the on-demand replay, as well as the slides from today's webinar. So we are at the top of the hour, so we're out of time. I hope we got to many of your questions, and anything that we didn't get to, as JC mentioned at the beginning, please feel free to email those to JC or to any one of the panelists, and we'd be happy to answer those for you after today's session. So I want to thank our panelists again, Linda, Andrea, Ryan, Judy, thank you very much, and I'll turn it back over to JC to close us out.
All right, I would like to thank all of our panelists, Jean, Linda, Andrea, Ryan, and Judy. Thank you so much for spending your time here on this Thursday to review, again, a very highly rated session at the 2017 IBS Forum. As Jean had mentioned, we will be distributing this sometime next week. Once we have the recording available, any registrant will be emailed the link. And it can also be found on our IBI website. In addition to that, we'll be distributing any additional materials that Jean will allow us to. When such mention was the fact sheet and to be determined on the PowerPoint. We have to make sure that's all clear to go. Otherwise, we encourage everyone to continue to pay attention to our 2017 post-forum webinars. They'll be coming up every 2 weeks over the next few months. They are all free to the public. If you have any questions, again, feel free to reach out to any of the panelists or the IBI staff. And with that, we thank you all for attending. And once again, thank you so much to our panelists for giving this awesome presentation.